Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
My name is Kip Heath and I am Deputy Trust Lead Healthcare Scientist at Great Ormond Street Hospital. This job means that I support our lead scientists to develop education and training opportunities for our science network. Here at Great Ormond Street, we have a scientific workforce of about 800 people covering over 35 specialisms. So it's a job for several people. Outside of my work at Great Ormond Street Hospital, I work for the National School of Healthcare Science, who are part of Health Education England, and I am a lead assessor for life science apprenticeships. This is a job I really enjoy because I get to support apprentices and scientists at all stages of their career, and I get to go and see them for their final assessment, and that means that I can be the person who is there at the very end of their training. I do all this because supporting scientists to develop in their career has always been my passion. I have mentored scientists pretty much since I left school. Some of those, even 15 years down the line, I am still in contact with, and I can still find out where they've been and where they're going. And it gives me a lot of satisfaction to know that I've played a small part in that development. So I have been in the NHS since I was 18. I joined on a 4-year trainee biomedical scientist program. And what this meant is that I spent 4 days a week working in an NHS hospital lab and 1 day a week at university. And at the end of the 4 years, I had a degree in applied biomedical science, my professional registration as a biomedical scientist, and also 4 years of work experience, which made it really easy when that contract was finished to go and find a role somewhere else. One of the things I've been most proud of is I was the driving force behind introducing degree apprenticeships for scientists at Great Ormond Street. It's a really important moment for me because this is the way that I joined the NHS, and so being able to offer that progression opportunity to sixth form students now is something that I'm very proud of. The vast majority of our patients are children. This means that we have a very specialised workforce because children are not just small adults. We have educators and specialists and world-leading healthcare professionals from all over the world, which we can learn from. But it also means that in order to make sure that our scientists have their own sort of well-rounded education, we need to make sure that we connect with local hospitals so that they can also be trained in adult healthcare. Here at Great Ormond Street, we have a large scientific workforce. We have, as a percentage, almost 13% of Great Ormond Street staff are scientists compared to only about 5% in your local hospital. We take patients from all over the world, not just from a local area, which means that scientists who work here have the opportunity to see conditions that you might work in your local hospital and not see in your entire career. My biggest piece of advice to anyone who wants to start working as an educator is to think about the type of education and the opportunities that you would have wanted when you were first starting out and try and replicate those for people coming after you.
My name's Ansel. I am Practice Educator for Healthcare Sciences here at Great Ormond Street Hospital for Children. As a professional, you constantly need to keep learning and developing to keep yourselves up to date with up-to-date practices, with the main aim to develop safe and efficient patient care. I started as a healthcare assistant, and then I've worked my way up through the sleep physiology department, starting as an assistant practitioner and working my way up through to a senior clinical physiologist. While I held all of these different roles, I had an understanding of what was required of the role and what was required to progress, which therefore in my education role, I can therefore help deliver this to that staff to help them develop and reach their full potential. Part of my education role is working with other professionals from other disciplines to develop an all-round holistic workforce and all-round holistic education. Working with our student nursing team, we were able to create a placement within sleep physiology for student nurses to come and experience what the role of a physiologist is, what the duties are, and how that relates to their role as nurses. This has been highly successful, and we have been running placements alongside the respiratory clinical team, as well as a hub and spoke, specifically bringing in student nurses for 1 week at a time. Another project I've worked on is an escape room with our simulation team. This is essentially looking at a team building and a team dynamic sort of work where they are put in a clinical simulations classroom. The door's locked and they have to solve a number of puzzles with both clinical and non-clinical functions. We designed this specifically around their clinical background, so therefore they had the expertise to deliver, and therefore they had to see how they worked in a team and worked differently to achieve the puzzle and therefore achieve the goal of escaping the room. The best part of this job is seeing the direct impact to the workforce. As a clinical professional, I'd often see the best part of my job being working with patients and seeing that patient journey progress. However, as an educator, it's what we see with our staff, how they're developing and how they progress in their careers.